Dr. George King from Harvard Medical School is here now, and you are hosting a Meet the Expert session. Insulin, heart disease, and cancer, what is the evidence? And I think that's what people really want to know. What is the current evidence?
Well, the role of and the connection between insulin and cardiovascular disease and cancer is one of the most important questions facing diabetes and diabetic patients today. There's a lot of circumstantial evidence that the two are related, and this is a hotly debated question for many years. And do insulin help or actually make these process worse? So our lab and many other labs has been looking into this question, and turn out it's a very complex question. It's possible that insulin could to do both, because insulin is a very complex hormone that causes many actions in the body and cells. So this question has huge impact for the patient, for the care providers, and for the researchers. So that's why it's so critical.
And I think you're delving into it even further in your lecture, talking about that vascular cellular connection with insulin. It's called Can Insulin's Vascular Actions Be Anti-Atherogenic? Can you give us a preview of that as well?
Sure. It's a great honor to actually receive the Edwin Bierman Award, and for multiple reasons. One, Dr. Bierman was actually my teacher when I was at the University of Washington as a resident and intern, so this is obviously a great honor.
Well, congratulations,
yes.
It's come full circle.
That's right, so it's very exciting. And secondly, obviously, to win an award from our peers is a wonderful thing. So I think the insulin effect on cardiovascular disease, which we've been studying for many years, is becoming very exciting. And the reason for that is I think we finally begin to understand how insulin could affect the blood vessels, the vascular wall that's causing the atherosclerosis. And the reason that's so exciting is as we learn more about insulin's action on the vessel wall, it has become very clear that insulin has both good and or anti-atherogenic and pro-atherogenic effect. So the reason that's also exciting is that means we can actually potentially design new insulins or new drugs that could enhance insulin's anti-atherogenic effect. So I think within next few years we should be able to either design or identify new drugs and new insulin that could actually not only treat diabetes by lowering glucose, but actually decrease atherosclerosis.
Such complex information. You've been studying it for decades, but what do you hope attendees take home from your talks?
Yes, so insulin is a very important and critical hormone for diabetic patients. And it's an important treatment for diabetic patients. It has a complex actions on the blood vessels, on all the body's parts of the body and the cells. And we're learning a great deal new information about the non-traditional action of insulin, and they're going to be important. So hopefully in the next few years we can actually design new insulin that could improve heart disease and may even decrease the risk for cancer.
And that would be so important for clinicians to take that information home to their patients as well.
Exactly.
Dr. King, thank you so much, and congratulations again on the Edwin Bierman Award.
Well, thank you very much.